want to start by thanking the opposition and the Greens for their work on this, the outstanding work that Senator Ruston and Senator Allman-Payne have done through estimates, through inquiries. I'd like to thank all the journalists who have covered the case studies, the real human impact of systems that aren't delivering for Australians. And often we hear about numbers. We hear about big numbers in terms of cost, number of Australians affected, etc., etc. Those numbers are humans. Behind every number is the story of an older Australian, their families, their support networks, their carers. And I just wanted to share one story that was sent to my office by a Canberran about a woman in her 70s that we'll call Donna. Donna was admitted to the Canberra hospital with confusion, cognitive decline and cellulitis after being unable to manage her own wound care. Over recent months, she has become lost in her community and picked up by police. She has not been eating and was not managing her own finances, spending well beyond her means. Her family had spent 9 months trying to arrange an ACAT assessment without success. In hospital, staff requested an ACAT, and I'm hearing a worrying trend, I think this has been the case for the last few years, where older Australians are having to go to hospital to then get priority ACAT assessments. But despite the cognitive decline, despite the fact that she wasn't eating, despite the fact that she was getting lost in her own neighbourhood, the algorithm said she qualified for a level 1 package. A level 1 package, that's less than 2 hours of care a week. And that can only be challenged through some complex reconsideration process with the department. So Donna couldn't be discharged because obviously the hospital knew that Donna's needs were far above a level 1 package. So she stayed in hospital. That's hardly a good outcome for anyone, for Donna, for her family, and for all of us who pay for our hospital system. We've heard from the government many times that there are humans involved, but it turns out that the humans involved are inputting the data, and then we pay someone to rubber stamp whatever the algorithm says. The person who's rubber stamping can't actually change the outcome. That's not proper oversight, and that needs to change. There's a welcome announcement from Minister A after the pressure from the Senate, but it's very unclear exactly what that's going to deliver. And so I really thank the Senate for debating this important issue, for this bill being brought forward to stand up for older Australians, to stand up for our communities, and to listen to the Robodebt Royal Commission. Commissioner Holmes was so clear about the need for human oversight when it comes to automated decision-making. Recommendations 17.1 and 17.2 of the Royal Commission talked about the need for a government-wide act that actually governs the use of automated decision-making in laws and in delegated legislation. As yet, we have not seen such a bill, and it's my understanding that the government is a fair way off doing that. 17.2 talked about the need for independent oversight, and this is a real frustration as senators when we ask the department how the algorithm actually works. We're told, well, commercial in confidence, we can't let you know that because then people could gain the system. So clearly we need an independent, well-resourced regulator of sorts that can actually look at the algorithm and decide, yes, this is in line with what we would expect. And so I commend this bill. Again, I thank Senators Ruston, Allman-Payne, the Coalition and the Greens for their work on this bill, and I commend it to the Senate.
David Pocock cuts through the Canberra spin like a knife. He stands up in the Senate and tells the raw truth about an elderly woman called Donna, confused, not eating, getting lost in her own neighbourhood, wound care falling apart. Her family battled for 9 months to get a proper assessment. Hospital staff finally stepped in, but the government's shiny new algorithm, it spat out a level 1 package, less than 2 hours of care a week. Pocock nails it. The humans involved are inputting the data, and then we pay someone to rubber stamp whatever the algorithm says. The person who's rubber stamping can't actually change the outcome. That's not care, that's bureaucracy on autopilot. Older Australians forced into hospital beds because the computer says they're fine at home with almost nothing. Taxpayers foot the bill for expensive hospital stays while families watch their loved ones deteriorate. This cross-party push, Coalition, Greens and Pocock, is forcing the Albanese government to blink. They rushed out some vague announcement on human oversight right before the vote, but it's thin gruel. The Royal Commission warned about this exact problem after Robodebt. Where's the real independent oversight? Where's the accountability? Pocock's right. Behind every statistic is a human story. Time to put qualified professionals back in charge, not unaccountable black box algorithms.